Hi, welcome to our telehealth video information series. I'm Garvin and this video is on Cimza. So what is Cimza used for? It's used for moderate to severe rheumatoid arthritis. So Cimza, or the chemical in it, certolizumab, is used in combination with methotrexate when other DMARDs, for example sulfasalazine, and have been ineffective. It can also be used for people with severe active progressive rheumatoid arthritis who have not previously been treated with methotrexate. So Cimza can also be used on its own for people who can't take methotrexate or when continued treatment with methotrexate is inappropriate. So how does Cimza work? Cimza injection contains the active ingredient certolizumab pegol, which is a type of a medicine called a tumour necrosis factor alpha, or TNF alpha blocker. It works by suppressing the process of inflammation. TNF alpha is a protein produced by the body that is involved in causing inflammation. It controls the activity of other inflammatory chemicals. TNF alpha is found in increased levels in various inflammatory conditions. It is found in the inflamed joints of people with rheumatoid arthritis and in the joints of people who have a type of arthritis affecting the spine called ankylosing spondylitis. It is also found in increased levels in the skin affected by psoriasis, as well as the joints of people who have a type of arthritis called psoriatic arthritis, which can occur in people with psoriasis. Inflammation occurs when TNF alpha acts on TNF receptors that are found on the surface of cells. Certolizumab pegol works by stopping TNF alpha from acting on these receptors. This prevents the inflammatory responses TNF alpha causes. In arthritic conditions, treatment with Cimza reduces the movement of inflammatory cells into inflamed areas of the joints. This reduces the signs and symptoms of arthritis, improves physical function of the joints, and reduces the rate of joint damage. When treating arthritis, Cimza is referred to as a disease-modifying anti-rheumatic drug, or DMARD. Cimza is only prescribed by specialists experienced with treating rheumatoid arthritis. It is administered as an injection under the skin or subcutaneously once every other week. Improvements in the symptoms of rheumatoid arthritis should be seen within 12 weeks of starting treatment. It is to be used with caution in elderly people, decreased kidney function, decreased liver function, people with a history of hepatitis B, dormant tuberculosis infection, and people with a history of recurrent illness or recurrent infections. People who have recently been receiving treatment that suppresses the activity of the immune system. For example, long-term oral corticosteroids, chemotherapy, radiotherapy, and medicines to prevent transplant rejection. Also, with caution in mild heart failure, demyelinating disorders such as multiple sclerosis, and people who are due to have a joint surgically repaired, and history of a recurrent cancer, heavy smokers, and chronic obstructive pulmonary disease. So all those conditions is to be used with caution, and it is not to be used in children and adolescents under 18 years of age. Active tuberculosis, it's not to be used for people with active tuberculosis, and also people with severe infections, for example abscesses, leg ulcers, and also not to be used in people with infection of the blood or body tissues with pus forming or other pathogenic organisms such as sepsis, and people with infections due to lowered resistance of the body, and moderate to severe heart failure, not to be used in pregnancy or breastfeeding. This medicine should not be used if you're allergic to any of its ingredients, so tell your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using the medicine and inform your doctor or pharmacist immediately. So regarding pregnancy and breastfeeding, there is no information about the safety of this medicine during pregnancy. It is not recommended for use during pregnancy as it could potentially be harmful to a developing baby. Women who could get pregnant should use an effective method of contraception to prevent pregnancy. both during treatment and for at least 5 months after the last injection. If you think you could be pregnant at any point during treatment, you should tell your doctor straight away. So, for breastfeeding, it is not known if this medicine passes into breast milk. However, it is possible that it does. It should only be used to treat women who are breastfeeding if the benefit to the mother outweigh any risk to the baby. It is important to get medical advice regarding breastfeeding if you are being treated with this medicine. So the side effects of Cimza, common side effects, bacterial, viral, or fungal infections, sometimes serious, and reactions such as pain, swelling, redness and bruising or itching at the injection site, and decreased numbers of red blood cells, white blood cells or platelets in the blood, headache, fever, increased blood pressure, inflammation of the liver, and rash and itching of the skin and feeling sick. And uncommon side effects would be allergic reactions, infection of the blood or body tissues with pus forming or other pathogenic organisms, cancer of solid organs and benign tumours or cysts, skin cancer or precancerous lesions, anxiety, mood changes, dizziness, heart problems, and blood clot in blood vessels, or deep vein thrombosis or pulmonary embolism, cough and asthma, skin reactions such as eczema, psoriasis, and hair loss. So the side effects I've mentioned does not include all the side effects reported by the medicine's manufacturer. For more information about any other possible risk associated with this medicine, you need to read the patient information leaflet that's provided with the medicine or speak to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription, and herbal medicines before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicine while taking this one to make sure the combination is safe. Cimza is not recommended for use in combination with anakinra or abatacept, as this combination may increase the risk of serious infections without an increase in efficacy against the disease treated. This medicine suppresses part of the immune system, so this means that vaccines may potentially be less effective if given during treatment, and live vaccines may cause serious infections. So live vaccines include measles, mumps, rubella, MMR, oral polio, oral typhoid and yellow fever. It is recommended that live vaccines are not given to people being treated with this medicine. That brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info. Or call into us at Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.